Hi, we are from the National Institute of Health, and we are going to talk about diabetes today.
About 24 million Americans currently are diagnosed with diabetes, and 79 million are thought to be pre-diabetic. About 5,000 cases of diabetes are diagnosed daily in the U.S.
If you have type 1 diabetes, listen closely because this will help you understand your disease. It is when insulin is not produced in the pancreas. Without insulin being produced, it is not released into the cell, and the cell does not send the message to the glucose transporters to open, which does not allow the glucose to be let in. Therefore, the glucose stays in your blood. There's a treatment for this, and it's what most people use. It's called an insulin pump. An insulin pump monitors the blood sugar levels and releases the insulin needed by the diabetic.
This is Erin. She is one of my diabetes patients. She just ate a meal high in glucose, so she needs to inject insulin. So here she has her syringe and needle where she will inject the insulin. So she ate quite a bit of glucose, so she will need quite a bit of insulin here. Okay, so this is how much insulin she needs. So when she injects it, she will press down on the top and put it into her skin. And now she will check her glucose levels, and they should be back to normal. Type 2 diabetes is when most of the insulin receptors are destroyed because of a person's unhealthy lifestyle. If the receptor sites are destroyed, there is no message in the cell to open the GLUT4 chambers, so glucose cannot enter the cell. So when there are high levels of glucose, most of it stays in the bloodstream and is not taken in by the cell. 16% of people with type 2 diabetes can treat their disease simply by eating healthy and exercising a lot. The rest of the people need to take an oral medication to help treat the disease.
There are many complications for diabetes. They include stress, hearing loss, which is twice as common for diabetics, and foot complications.
Foot complications include neuropathy, which is nerve damage, calluses, foot ulcers, which could lead to infections and limb loss, and loss of blood flow to the feet, which can include gangrene.
Hi, Erin. What? Hi. Hello. How are you? There are many nutritional foods that diabetics should or should not eat. They should eat about less than 6 ounces of carbs a day to reduce blood sugar, about 5 teaspoons of fats per day, and eat a lot of protein. Also, diabetics should eat about the same time each day and the same amount of food.
If diabetes isn't treated properly, it could lead to oral health problems like gum disease, dry mouth, and teeth loss. Also, people with diabetes have a higher risk for eye complications like glaucoma, cataracts, vision loss, and blindness.
A V L N D O K.
To check your blood glucose levels, you need to prick your finger. Then you put the blood on a test strip and place the strip into the glucose blood meter. The meter will read your blood sugar levels, and then you will follow your doctor's instructions on how to manage the levels. In type 1 diabetes, you need to check your glucose levels about 3 times a day before and after meals, when you exercise, and before going to bed. In type 2 diabetes, some people don't need to ever check their blood glucose levels, but if you do, you should check more than 1 time a day.
It is important to check your blood sugar levels regularly because diabetic emergencies can occur. 2 types of diabetic emergencies are hyperglycemia and hypoglycemia. In order to avoid the diabetic emergencies, you need to learn how to manage it. If you need to inject insulin yourself, it is important you know how much insulin you need in order to keep your glucose levels normal. Be sure that your doctor explains to you how to inject insulin and how much insulin to inject. If you have an insulin pump, you will not have to worry about diabetic emergencies as much.
The first type of diabetic emergency is hyperglycemia. Hyperglycemia is when there's too much sugar in the blood. Signs of this include needing to use the restroom a lot, drinking lots of water, and being confused and disoriented.
The second type of a diabetic emergency is hypoglycemia. It is when there is not enough sugar in the blood. The symptoms include dizziness, trembling and clamminess, feeling weak, blurred vision, passing out, and hunger.
Having diabetes will change your life in many ways.
You'll need to be sure to eat healthy and exercise daily.
Each day you'll need to address diabetes with the appropriate treatment.
Finally, you will need to check in with your diabetes doctor for every 3 to 6 months and also have regular checkups with an eye doctor and a foot doctor.